Hi, my name is Dr. An. Today I wanted to talk to you about what regenerative medicine is and what stem cell therapy is and how they can help you improve your health, get out of pain, and possibly change your life. Again, my name is Dr. An. I've been a wellness consultant for the last 15 years. I am a member of the Academy of Regenerative Practices. I'm currently enrolled in a stem cell fellowship program with American Academy of Anti-Aging. I am a doctor of chiropractic, but I'm also a family nurse practitioner. I have a bachelor's degree in biochemistry from University of Houston, and I actually worked for MD Anderson in the Department of Biochemistry before I became a doctor. I'm also a published author of the book The Pain Free Knee, which is available on Amazon, but you can also pick up a copy of this book from the clinic as well. I recently completed co authoring a book with a colleague called Demystifying Stem Cells, which should be published or out for available January 2019. Now, keep in mind that this presentation is about 60 minutes of lecture compressed in 15 to 20 minutes. So if you have any questions that is not covered during this presentation, any of our doctors in the clinic will be happy to answer them for you. Since 2013, we have performed more than 1,200 different procedures using these regenerative medicine and stem cell therapy. And we have performed more than 600 procedures into the knee, with the patients reporting on average 60 to 70% improvement of their symptoms in a 6 to 8 month mark. We have also performed many different procedures using these stem cell and regenerative medicine tissues to take care of shoulder pain, neck pain, back pain, hand pains, ankle pains, tendonitis, and even peripheral neuropathy, with overall patients reporting about 72% reduction of symptoms at a 3 month mark. So, what is regenerative medicine? I want you to think the opposite of degeneration. Degeneration is something that gets worse with time. Regeneration would be something that actually gets better with the time. So, it is a little bit like turning back the biological clock of your body. So, for example, stem cells, they have the ability to turn into several different tissues in the body. So, if I can take the stem cells and put it into a damaged joint, it can form new ligaments and new meniscus. If I can put these stem cells into a damaged heart tissue, then it can regenerate and repair the damaged heart tissues. The difference between stem cell therapy and everything else that you have tried is that stem cell therapy doesn't just mask your symptoms, it actually heals the damaged tissue. Again, like I said earlier, it is a bit like turning back the biological clock of your body. So here's a patient, 59-year-old male patient that we took care of. He initially came to us with a very bad knee pain, knee arthritis. As you can see in the picture on the left here, he was almost bone and bone in one part of his knee, and he was dead set determined not to get the knee replacement surgery because he had a buddy and a neighbor who had had it done, and it didn't turn out so well for them. So we did a 1 round of stem cell injection, but please remember that it is not the only thing that we did. We also recommended him different types of rehabilitation, such as knee decompression therapy, laser treatment, and we also gave him supportive knee brace as well too. And this is a 10-month follow-up of the same patient, and as you can see a very nice growth in that knee joint, with the patient reporting almost 100% improvement of his knee pain. And as a matter of fact, he described this improvement as "I feel like a lizard who grew a new tail." So, what are some of the treatment options that have been available to you? A lot of people, when pains and aches start, they start taking pain medicine. These are short for non-steroidal anti-inflammatory drugs. And when the medication fails, some people may get steroid or cortisone injection from doctors. And when medication and steroids quit working, some people end up getting surgery, sometimes more than once. So, what's the problem with these pain medicine? Well, there are 70 million prescriptions for pain medicine that is being given out every year. And that puts about 100,000 people in hospitals, and about 15,000 people will die every year from taking these NSAID type of pain medicine. I think this is a gross underestimate. One very serious side effects of taking these pain medicine is a increased chance, 60% increased chance of developing heart failure. When you consider that the heart problem is a number one cause of death in this country, it is not unreasonable to think that a lot of these heart problems is actually being caused by the pain medicine. It is also the number one cause of acute liver failure, and it is also one of the leading cause of kidney failure as well. And it will also erode the lining of your stomach. And senior citizens must remember that bleeding ulcer is one of the common cause of death because of these pain medicine. Your second option, cortisone injection. Every time you get a cortisone injection, you can develop up to 8% of bone loss in a 4-month period. And doctors routinely recommend quarterly injections every 3 months. That is not because that's how your body works, but that is because how many insurance companies will pay for. So, potentially after the third steroid injection, you can have up to 24% loss of the bone loss in that joint. It is also one of the leading cause of cataract, so it can make you go blind. It will also throw the hormones in your body out of whack. So, patients report to us they've gained a lot of weight after 2, 3 steroid injection. It can also cause diabetes and suppress your immune system as well too. Surgery has a lot of failure rate. Because of that, often people who get one surgery ends up getting another surgery, second surgery, third surgery, and even fourth one. You can bleed to die on the surgical table, and blood clots can form even weeks after the surgery. And the general statistics on surgery is that 1 in 400 people who go through surgery will end up dying. And because of these failed pain interventions, a lot of people ends up taking and become addicted to narcotic pain medicine as well. And narcotic pain medicine such as opioid, hydrocodone, those type of medication is now killing 1,000 people a week in this country. So we have a big problem. And today you have to make a decision to try something new and different that you haven't tried, because all these options that have been available to you can be potentially deadly. So what are the stem cells again? Stem cells are immature cells that can turn into many different tissues in the body. One characteristic of stem cell, or what makes a cell stem cell, is the fact that they have to self-renew and self-replicate. It means one cell can divide to become 2, 2 can become 4, 4 can become 8, 8 can become 16. This is called exponential growth. Other characteristic of regenerative medicine or stem cell is that number one, they're potently anti-inflammatory, which means if you've got an inflammatory condition such as arthritis, chronic pain, old or acute injury, it is really phenomenal. Second characteristic of regenerative medicine is that it is potent immunomodulating agents. Let me explain what that means to you. It means if your immune system is overactive, stem cell or regenerative medicine has the ability to bring it down to the normal level. And if you have underactive immune system, it has the ability to bring it up to the normal level. And third, these regenerative medicine tissues, they are potent antibacterial, antimicrobial, and antiviral, which means it is really phenomenal for wound healing. And the best part is that these tissues have a very strong safety profile with minimum side effects. And if anything was reported, it was so mild that normally they went away without any treatment or intervention in a couple of days. Now, the one question that we get most frequently from our patient is that what kind of stem cells are used? There are 3 types of stem cells that we can use. The first place is your own body's bone marrow. We'll drill a hole into your femur or hip bone and suck the marrow out and isolate the stem cell from it and inject it back into your body. It's nothing new. It's been used since 1968. Second place where we can get a lot of stem cells from is adipose or your body's own fat cells. So I call it the double-edged sword of stem cell because fat is, gaining weight is not good for us. But these fat cells contain a lot of stem cells that we can use to treat many different conditions. And the third place where we can get the stem cells from is what doctors call the waste product of birthing process, such as umbilical cord tissue, amniotic membrane, and placenta. Now, please understand that these do not contain any type of aborted fetal tissue or embryonic stem cell because these tissues are being thrown away and considered a waste. There is little or no ethical consideration. In our office currently, we mostly use umbilical cord tissue and amniotic tissues, and I'm going to explain to you why in a bit. So, the first two places that we talked about, which is harvesting stem cells from your own bone marrow or fat stem cell, you have to remember that your body's stem cell quality decreases dramatically as you get older. I'm not saying that these stem cell therapy do not work, it's just that the result of the stem cell therapy depends greatly according to the patient's age. And the more sicker the patient is and the more medications the patient is taking, you can expect the quality of these patients' stem cells are not going to be that great. Second reason we don't use adipose or bone marrow at the moment is because as we get older, we drastically lose the number of stem cell. So when we're born with a very large number of stem cell, as you can see. But even by the time you get to be age 50 or age 80, that number of stem cell, we just do not have that much stem cell left in us anyways. And this is the very definition of aging. Aging is nothing more than us losing the number of stem cells in the body, losing the ability to renew and regenerate as we get older due to the lack of stem cell. Some of the other tissues that is considered regenerative medicine, we mentioned the umbilical cord tissue. We can also use the amniotic membrane and amniotic fluid. In the new exciting field of regenerative medicine, we have a new item called exosomes. And my favorite regenerative medicine, it's called platelet-rich plasma or PRP. And I'm going to explain to you what they are. Well, the umbilical cord tissue, as we mentioned earlier, they are cord tissues donated in a hospital settings from a healthy mother donors. Once the mothers volunteer to donate the tissues, then they have to go through extensive health screening to rule out any contagious diseases such as hepatitis C and HIV. And these tissues are heavily regulated by FDA's 361 human tissue product. And they're also regulated very much like the way donated blood is regulated. Now, some of you may be wondering, it comes from another woman's body. Does it need to be matched with my own blood type? The answer is no, because these stem cells are so immature that other people's body do not recognize it as a foreign object. So what doctors call the host versus graft rejection, you do not have to worry about that. And that is the most beautiful thing because this can potentially help so many patients. But the unfortunate fact is less than 0.01% of all the donatable tissues are being donated right now. So there is definitely that supply and demand thing going on. And so as a consumer, you have to be very knowledgeable with what kind of tissues or cells you're receiving. In our clinic, we work with very carefully vetted 3 companies that I myself have visited and make sure that they are manufacturing these tissues according to the FDA's guideline. And they also come with a third-party independent cell count study that documents the number of stem cells in it. And if it is a umbilical cord tissue or amniotic tissue, we keep them cryopreserved in a minus 200 degree liquid nitrogen tank. We also periodically perform our own cell count studies as well to ensure the quality of the cells that we're providing to you is the highest quality that will give us the best result. Now, the second, third type of regenerative medicine, platelet-rich plasma therapy or PRP, is performed by drawing the patient's own blood out and centrifuging it and treating it and activating it. And the platelet normally looks yellow like this right here. And we can take this platelet out of the tube and inject it into any part of your body where you're hurting or having problem with. And it has a lot of growth factors, your own body's growth factors and cytokines. And it is also considered a very potent regenerative medicine therapy. Again, the latest in the regenerative medicine is what is called exosomes. Exosomes are tiny little messengers of your body that helps your body communicate better. So how is the procedure done? Normally takes about 15 to 30 minutes in the clinic using local anesthesia. It's really not that complicated. It's a simple procedure. We keep these tissues frozen and we do not take it out until just before we inject it into you. And we also have a very specific way of thawing it to preserve the cell viability as well. There are just a couple of things that we ask you to do, and that is if you've been taking prednisone or NSAID type of pain medication, not all medication, but pain medication, we're going to ask you to stop taking it for about 3 days before the procedure, and that is if you can. After the therapy, we're going to ask you to stay off these medicine for about 14 days, and if you get it into a joint, please avoid the steroid injection for another 6 weeks. And we'll be also recommending you very set specific post-care instruction that helps you eat a type of food that can help your body's stem cell grow better as well. This is what typical joint injections look like. We use a video fluoroscopy to visualize where we're injecting so we don't end up missing your joint capsule. So we have talked about so far different treatment options that have been available to you and a new option that you can try, which is regenerative medicine, PRP, and stem cell therapy. So if you don't make a decision to try something new, that means you're going to continue to take drug, continue to take steroid, and continue to, in the future, you may end up getting a surgery with a potentially deadly outcome. The definition of expecting a different outcome with same thing that you have tried, what is the definition of that? That would be insanity. And I hope you're ready to stop this insanity and try something new and different today. Here's another patient that we took care of. Almost came with, again, bone-on-bone presentation. This is a 12-month follow-up with a very nice growth in between, with the patient reporting approximately 80% reduction in pain. The cost of the regenerative medicine and stem cell therapy depends on what kind of tissues we're going to use. I think most of you already know that these type of treatment is considered an elective service, and insurance companies do not pay for this type of treatment. PRP costs $850 per an injection, and the most expensive upscale would be umbilical cord tissue, which contains the most number of stem cells in it, and that is approximately $6,000, and that is per 1 cc of volume. Exosome and amniotic tissues have its own pricing as well too, and our case managers will be able to sit down with you and go over what the doctor recommended would be the best treatment option for you, and what kind of payment options that you have available. And that is all I have for you today. And if you have any questions, please don't hesitate to ask any of our doctors or case managers, and they'll be able to assist you in any way they can.